Hi, welcome to Module 7. In this first video, we will be reviewing the care of families with chronic illness. The module learning outcomes for this video are to discuss the impact of chronic illness on the family system, evaluate the role of the nurse in empowering families caring for those with chronic illness, and to investigate resources for families to cope with the challenges related to caring for individuals with chronic illness. In thinking about chronic illness, it does impact families in many ways, and it can be dependent on the type of illness, how the family functions, and as we've looked at different family processes and functions, even before an illness, it can certainly affect how that chronic illness then does impact the family, and then also the time phase of the illness as you go from acute to chronic to the end of life stage. And nurses, as you know, are working with families to enhance the care of those individuals with a chronic illness. So per your textbook, it uses the definition of a chronic illness as a condition that lasts 3 months or longer, that rarely resolves spontaneously, and is rarely curable. And the textbook uses diabetes for both the young adult and the older adult as an example of a chronic illness. And if we think about how that chronic illness does impact the individual, it can be on many levels, from social to cognitive, emotional, spiritual, physical, and in their time perspective. It can require care from multiple professionals, communication between professionals and family members, and any time that there is poor communication, we can subsequently have preventable complications, conflict, stress, hospitalizations may increase, expense, and early death. In categorizing a chronic illness, some of these factors should be looked at. What is the level of disability? Diabetes versus a stroke that may lead to some residual functional issues. The perception of that individual and the family on how that disease does affect their daily living and how do they adapt to it. The age of onset, is it something that is considered as expected or unexpected, so an off-time event? What are the symptoms that they have to live with? Is it stable or something that does have frequent relapsing and regressing moments and maybe frequent hospitalizations? And then how does it impact the family functioning? Some family members may adapt very well, and especially if they feel they have the skills they need and they have a strong family relationship, and others may find even a minor chronic illness with a degree of disability may affect the whole family system. What is the degree of care required? And then what other diagnoses are also present? And as you know, with chronic illness, oftentimes there are concurrent diagnoses that do affect that individual as well. If we look at a historical perspective, back in the 20s, the leading cause of death was pneumonia, tuberculosis, the flu. And now today, you know that oftentimes it is heart disease. Is it something that is preventable? And we've talked about genetics, but we can also think about lifestyle choices that can contribute to heart disease, such as obesity, poor eating habits, etc. And then also, too, how does low health literacy affect individuals as far as prevention of heart disease? Do they have limited information and access to health screenings and care? If we think about minority populations, those whose English is not strong, those who are living in poverty, and also there's concern about those living in rural areas of not having the access to care. So your textbook speaks to the incidence of chronic illness in America, and that 133 million Americans are currently living with a chronic illness. It's predicted that by 2020, 157 million Americans will have a chronic illness, and 20 million children under the age of 18 live with a chronic illness. More than half of the adults with a chronic illness will have 2 or more diagnoses, 88% of adults over age 65 have one or more chronic conditions, causing 66% of all deaths. And more than 1.7 million Americans die each year of a chronic illness, leading to 70% of all deaths. So the impact is certainly there on our population and our healthcare system. So the common chronic illnesses, which I'm sure you're very aware of: heart disease, stroke, diabetes, obesity, cancer, pulmonary disease, and mental illness. These categories alone causing more than 70% of all deaths annually. And then looking at the cost of chronic disease. It's been said that the cost of heart disease and strokes is $448 billion. Diabetes costs $174 billion per year, and they estimate $116 billion in direct costs related to complications. 1 in 5 healthcare dollars is spent on individuals with diabetes. Obesity costs $117 billion per year. Cancer, $89 billion. Arthritis, $81 billion. And you think about lost productivity from pain associated with arthritis, and that's estimated $128 billion a year. And 40% of families with children with chronic illness experience financial burden. So what can we do with prevention? And here's some statistics looking at for every dollar spent, what you can save. So fluoride is a good example of saving dental care, of just adding that to water. HIV and STD prevention programs, a dollar can save $2.65. Diabetic preconception care, saving $5.19. So giving the example that a mammogram can estimate savings of $9,000 in cancer treatment. Pain management for individuals with arthritis saves an estimated $2.5 million, looking at lost productivity. And a reduction in obesity saves $254 billion in productivity and $60 billion in annual treatment expenditures. So it seems like minor cost for a large savings. This graph looks at our healthcare spending, and 83% of healthcare dollars are spent in the prevention, treatment, management, and research related to chronic conditions. So quite a large chunk of federal healthcare spending related to chronic conditions. And looking at healthcare costs in 2014, it's expected to increase to $3 trillion, largely because of the increased incidence and treatment of chronic illnesses, lost productivity, and increased pharmaceutical costs. So a very large portion of our domestic product. Looking at families with children with chronic illness does have a impact to them, and that 11% of families living in near poor income brackets don't receive the needed support, compared with only 7% of middle to high income families. So families may fear that they can't afford suggested treatments, and children with chronic illnesses are known to have up to 5 times the healthcare costs compared to children without chronic illnesses. Children with chronic illnesses are also more likely to have a parent that has to stay home rather than work because of care needs, lack of childcare for chronically ill children, and lack of trust of non-family members providing complex care. This cost doesn't account for other non-measured costs, including dietary changes, supplements, over-the-counter medications, lost productivity at work, non-medical educational therapies outside the school, added costs of specialized child care, and costs of uncoordinated care across professionals. So why the growing trend? We know we have increased preterm births. Children that would not have survived in the past are surviving, but yet with that comes some complex needs. Increased multiple births, Increased longevity of childhood disorders, for example, cystic fibrosis and Down syndrome, where they may not have lived very long into adulthood, they are now. And the increased incidence of chronic conditions like autism, attention deficit disorder, obesity, depression, bipolar disorder, cancer, asthma. And think about a child who has a chronic condition, oftentimes will have another chronic condition associated with it. So why the growing trend? If we look at life expectancy, how that has changed from 1900 to 2003, it is dramatic. And children that are likely to have chronic conditions related to genetics and their early environment, whereas adults are more likely to have chronic conditions related to a combination of genetics, early environment, and lifestyle choices and experiences. So it is a combination of biology, psychology, sociology, and economics that predicts chronic illness and increased rates of chronic illness in adults. So when looking at the family response to chronic illness, they do vary, and it may depend on the characteristics of the ill individual. Are there additional stressors? What are the coping skills of the family as they move into this role, caring for an individual with a chronic illness? What resources are available, looking at finances, time, their knowledge, and social and emotional support? What are their values and beliefs regarding chronic illness? And what is the duration and characteristics of the illness? So thinking about these, we looked at an eco map back early in the course, looking at the resources for a family. So you can imagine that a family with an individual with a chronic illness would need more outside reach. So this chronic healthcare model was designed looking at the deficiencies of the current healthcare system, which included rush practitioners, lacking the time or knowledge of coordinated holistic care, that included the family and the larger system, and not just blaming individuals. The model emphasizes proactive care and prevention rather than reactive care that treats only complications. It does save money and it's more efficient because prevention is emphasized. Care is coordinated, and information and education are provided for providers, individuals, and families. This leads to quality care with fewer errors, fewer preventable complications, better management of the disease, and includes individuals, families, and communities, and improves family satisfaction. So the model does look at a holistic approach that looks at the needs of the individual, but also the family system and how it impacts the family system. So this family health model starts with nurses being able to understand how family members define themselves and then how they communicate with larger social systems. So each domain is considered, the context, the structure and function, and looks at each area under the domain. So you begin with the view of the family within the social construction of family health at the time of assessment. And it looks at definitions of health, well-being, what is family-focused care, what is the family, and you look at that unit of care, who is that particular individual with a chronic illness within the family. And using that model, how to assess that family, part of the contextual is looking at the developmental stage. The group project that you have coming up is to look at a particular developmental stage and some of the risks of families within that. What are some of the traits and characteristics of that family? Do they have access to care? And a genogram might help to identify some of this. Then looking at the functional assessment, what skills does the family already possess? What roles, multiple roles that individuals may take on? What are the communication patterns? And then looking at the structural domain, the characteristics of that illness, how is the family organized? Is there chaos related to that particular chronic condition? Your textbook uses the Yates family as an example of a child with a chronic condition and also speaks to some of the potential reactions that may be from the sibling of that child with a chronic illness. Thinking about guilt because they may consider that they've caused the illness or they've been spared it. They're trying to be the good child because they're trying to protect their parents from any further distress. They may resent their sibling because of the increased attention that they get, which could lead to loss and isolation. They may be embarrassed about their siblings' appearance or behavior, and they have guilt about their own abilities and success. They may have increased responsibilities, which may lead to frustration. And so we want to look at are there some positive also effects that could be that maybe they do develop increased empathy, patience, resiliency, sensitivity, and compassion because of that experience of living with a sibling with a chronic illness. Then looking at the parent's reaction, um, is it a shared reaction? Oftentimes, the female might be considered the primary caregiver. And so, what is the reaction to that? What are the expectations of healthy siblings? How does that family try to normalize it? Is there open discussion? Is there attempts at normalizing the new normal? Looking at their parenting approaches so that there is normalcy there and using treatment that fits in with that, and again interacting with others based on how does that child fit in. So the resilience is often based on how they do adapt and change to that um, new situation. So looking at the nursing role with chronic illness, it is to maintain or improve family cohesion because anytime there is an overwhelming caregiving role, it may lead to distress among the family. Try to maintain or increase family communication, support adaptation, and also flexible boundaries and using social and professional assistance, that it isn't a sign of weakness, but that it is needed. So part of the role will be looking at what are outside resources that can be effective for this family system. Also, the nurse's role during the chronic phase is looking at other stressors. So again, is this timing something that is expected or not? What are the developmental stages of that particular family? And how do they look at themselves as a family unit rather than an ill family? How do they renegotiate roles and plan for future changes? And assisting each other with communication, coping, and use of outside resources. In working with a family with an adult with chronic illness, using that family health model will assist you in assessing the context, structure, and function, and then how the illness impacts the physical, emotional, relational, vocational, and social aspects of that family. Your textbook on page 248 talks about core family processes with chronic illness and what these processes are with their definition and areas of concern. So, for example, communication, it is a primary way the family members are socialized how to interact about health beliefs, values, attitudes, and behaviors, and incorporate that health information and knowledge into their health and illness concerns. So, areas of concern may affect the language that is used, the access to information, what knowledge and skills are needed, what emotional needs are needed, spiritual needs, coaching needs. So, considering all of these and how that impacts the particular family. So, in summary, some nursing interventions that can be used for families with individuals with chronic illness are creating an atmosphere of family focused care, which has mutual trust, looking to prevent or reduce health risks so that it is proactive, looking to maintain optimal health even in the case of a chronic illness, providing access to resources, information, and education, educating families on care management routines and how to accommodate changes. It can be optimizing strengths for family members and the family as a whole so that beginning assessment may help to identify strengths of family members, empower families to access care as needed and to request assistance when needed. Looking at how disease management routines can be part of a family's daily life, looking at developmental needs, and then how of the family processes, how are they being addressed? And those were presented on a previous slide.